So, how much money will you need to cover health care expenses in retirement? Well, whatever it is, a new report finds that nearly half of all workers do not think they will have enough. And in fact, only 1 in 5 have actually crunched the numbers. Our senior personal finance correspondent, Sharon Epperson, has done some digging. She joins us now with that magic number. Is there a magic number, or how much are you going to need?
There is a magic number that people may be a little frightened by. And for a 65-year-old couple retiring this year, they'll need $280,000 to cover health care expenses in retirement. Now, this assumes that they're both already eligible for Medicare. And the good news is it's only 2% higher than it was last year. So we are seeing Medicare premiums relatively flat, out-of-pocket prescription drugs also relatively flat over the past year or so.
Okay, so that key number is 65 years old.
65 years old.
What if you retire earlier? A lot of people, want to travel and do things while they're younger. What if you retire earlier?
It's interesting. That is what we assume, that they're retiring earlier because they want to travel. Many people are retiring earlier because of a health care issue. The median retirement age, according to the Employee Benefit Research Institute, is 62 years old. And so when you're retiring early, if you're able to get health care coverage, you may still have to come up with an extra $500 a month in premiums. You may also have to dig into your personal savings if you haven't saved properly. So these are all things that are a concern to people who are retiring before 65, because of course that's when Medicare kicks in.
Let me go back to something you said. How do you get the health insurance if you retire early?
If you retire early, the first thing you want to do is check to see if your employer has a retirement benefit program for health care that you can participate in. The other thing are the COBRA provisions. Those last for up to 18 months. So strategically, if you want to retire early, retire at 63 and a half. That exact number.
Okay.
And then, of course, also the Affordable Care Act provides a lot of provisions for those between 55 and 64. You're going to want to look at the various options that you may have with that, but talk to a financial advisor and accountant, too, to see if you can plan with your income to get some of those tax credits and subsidies to lower that amount, because that amount could also, at full price, be $1,000 a month.
A lot of people feel like they have to work longer because they haven't saved enough. What if you retire after age 65?
Well, you have to look at all the different Medicare programs and make sure that you apply immediately for Medicare Part B. You want to make sure that you get that medical coverage and you don't wait, because you could be penalized if you wait to get that. The other thing is considering a Medicare Advantage plan. That will cover your dental and your vision expenses. You may want to look into that. Medigap, also important if you want to get some type of coverage for copays and deductibles and all that. The most important thing for anyone, regardless if you're thinking about retiring right now or you're going to retire at 65, always look at what the options are for you. Look at that open enrollment. No one ever wants to, you're smiling because no one ever wants to look at that material, but it can change.
But it can change,
absolutely. It can change, and you can get a better deal. You never know.
Well, you've got me thinking, that's for sure. As always, thank you, Sharon Epperson.
Sure.